I do know that for the last few weeks, the media has been asking for information regarding the hospital, so I wanted to do two things to sort of bring you up to speed on some of the events that has happened with the hospital, and also to thank a lot of community agencies for stepping up and being of service and responding to this crisis. So I'm going to just start out by saying, and first I'd like to just thank those who are joining me at the dais here for this important meeting and this important press conference. As you all know, due to last week's announcement regarding the suspension of services at both Trimble and Hillside Hospital, our community was left stunned, angry, and frustrated. And in that spirit, I'd like to thank those agencies who stepped up, and all of them aren't with us, who were blindsided by this announcement. St. Vincent de Paul Catholic Charities, they'll be offering meals, rent, and utility assistance to the members. Also to Trimble County Action and Planning, TCAP, also known as TCAP, for their group application that they're working on. And we have with us Mr. Cedric Brown from that agency to assist with rent and utility and food vouchers as well. So I'd like to thank Cedric on behalf of TCAP for that. And also to the Trimble County Job and Family Services for hosting a rapid response event for the hospital employees tomorrow at Kent State Trimble campus at 11 a.m. and a makeup session for those who can't make that time for 1 p.m. That's out at the Trimble campus. And also, I'd like to thank Pastor Johnson, Councilman Johnson as well. And if you could, he has an event planned or a program planned for those workers as well. It's for members of his church. Yeah, sorry. But I want to thank you because I will say that he has a lot of parishioners who are affected by this suspension of services. And I want to thank him for all that he's doing for them and providing that assistance. Every little bit goes a long way. And we want to help everyone. On some of these programs, there's no income verification guidelines. On some, there are. So we tried to include everyone in every agency that could reach the broadest net. To that end, I'd like to thank Safety Service Director Eddie Colbert, who really coordinated all of those efforts with all of those agencies. Thanks, Eddie. We finally are seeing some positive results from that effort. And I'd also like to introduce Councilman Ron White of the 7th Ward for being here with us today. As you all know, once again, it's truly a travesty for Trimble and Hillside hospitals to be on total diversion because the community needs both of those hospitals to be open, and our workers need to be paid. Those workers need to be paid. I understand, it's my understanding that our pleas for back payment has been answered. I think some payments have gone out to some of those workers for services rendered, and we're very thankful for that. But we want them paid for all of their services. And to that end, I'll have more to say on that because they deserve to be worked for this, paid and compensated for the services that they provided. And to that end, I'll just stress again, these hospitals deserve to receive their full payments so that they can in turn make payroll and start bringing those services and employees back. Let me be clear, and I think Tom can speak to this. Insight does have a plan, but they can't do it without the funds that are being held by Steward, and I want to emphasize that. The citizens of Warren and Trimble County shouldn't be burdened with paying for a Steward's bankruptcy. We've paid too much for Steward's problems and profits already. Knowingly, the law of the state of Ohio talks about Medicare and Medicaid fraud. And it defines Medicare and Medicaid fraud as knowingly to make or cause to be made false or misleading statements or representations to obtain medical reimbursements. This includes, but is not limited to, billing for goods and services not provided and providing medically unnecessary products or services. This gets to the TSA agreement that's at the heart of this crisis. And it also states that billing for a more expensive product or services than that was delivered, or to bill separately for services that should be billed together and billed twice for the same product or service. Let me be clear. Stewart, our citizens, our community they deserve and are entitled to this money. This scheme must stop. I'm calling on our federal delegations, Senator Husted, Senator Marino, and Congressman Joyce, and all of those federal authorities to investigate criminally where the Medicaid and Medicare dollars went. These are public dollars, and they can't sit on them. It's not theirs. It's not right. Millions of dollars are at stake, and our community's health care is at stake as well. So that's all I want to say on it. I thank you for coming, but we will not stop until we get some resolution on where this is going. So we will have letters going out to those our federal delegation to ask for them to look into this matter. With that, we'll take any questions.
Have they given you any clarity, any timeline about what comes next, when that funding could potentially be released to Insight?
No, they haven't. One thing I will say is Insight has been very transparent with myself. Every time I call, they pick up and tell me where they are with this process. So I'm doing all that I can. Sooner is obviously better than later, but we're pleased to announce that some of the workers have been compensated, but it's not enough. They owe Insight a lot of money, and if they had been paid what they were for the service that they billed for, we wouldn't be sitting here today. This is almost extortion. That's why I believe this should be a criminal investigation, not a civil one, because a civil investigation puts Stewart right in a place where they're very comfortable. All they have left is bankruptcy lawyers. They have nothing else. So we need our federal delegation to step in.
Who have you been speaking with Insight?
Their government relations director and the director of operations, the president of the company. So they've been very transparent, and they always return my calls.
You say they've been transparent. What are some of the things that they've been really focusing on with you?
Well, some of those things, could be subject to litigation, but they talk a lot about the TSA agreement. I think that's where the misinformation comes from, and how that flow of money that they're owed gets lost in misrepresentation of facts.
And we've been trying to reach out to Insight. I know about the other
I can't speak for them.
Okay.
I can't speak for them, but they do return my calls.
Absolutely.
And which employees have been receiving their pay?
I will let Tom,
Yeah,
you can speak to
yeah,
that.
thanks. First of all, I want to thank the mayor. He's always been there for us, always, and all these members of the city. I just returned from the council meeting, and once again, the community support is there. So I just want to say briefly, we've all got problems. Elon Musk this and the Ukraine that and prices of eggs in the shopping. But when you're in the back of an ambulance or your loved one is holding their chest or someone cuts an artery at home, all of those things fall to the back of the list. And all of a sudden that is tantamount to everybody's priorities. So on March 28th, we got a death sentence, essentially. We were all told to leave the hospital. It amounts to a lockout, I believe, and we're going to let our attorneys figure that out and sort it out. But they ushered us out of the hospital. They didn't give us pay. They haven't spoken to us but yesterday when they told me they were finally going to reimburse them partial pay, and there's a lot of errors in that too. Suffice it to say, though, we want the hospital reopened, and we want our jobs back. But We're not going to get treated like this. We are not. I've got nurses that are infuriated by this. I have 3 nurses that are expecting to have a baby here, and they've lost their health care as of March 31st. 2 days warning they got for that. So they're all scrambling to figure out what to do with their lives. And we'll get it worked out, and various agencies gratefully have stepped up and are providing relief to my members and the other members of the locals and to the other non-represented employees as well. So I congratulate them. But this blaming Stewart, while it's very good for them to soothe their consciences, my members don't have a place in that. We're there to take care of patients, and that's what we've done. And we expect to reimburse it so we can take care of our families with it and everything else. So get your stuff settled with Stewart. Call whatever lawyer you have to. Call Matt Dillon. I don't really give a damn. Do whatever you need to do to get them off of your backs, because we cannot work like this. I mean, my members are almost determined to a nurse not to return to the hospital. And you try and run a hospital without nurses. I'll congratulate you if you can do it. So something needs to be done with this. I encourage Insight, to sit down with us and talk to us face to face and tell us what their plans are, and not this, well, we might, well, we could. There's no timeline for that. And we want to know what's going on so that we can go on with our lives. Because as we speak, there's probably 20 nurses right now getting interviews elsewhere for that. We were already nurses down. We were already understaffed. We can't afford for these people to leave us. So that's all I have to say. I do want to say, though, again, I want to thank the mayor. I want to thank him for whatever conversations he's having about that. But if we're not part of the solution, we're going to rapidly become part of the problem. Thank you.
Thank you.
Yeah.
And to that effect, my next conversations will be expounding on those facts. You can't just be transparent with me. You have to be transparent with those who are directly affected. So I will make sure that they understand that's my position as well. I share that, and that won't be tolerated by this office. I'm not their mouthpiece.
If we need a chaperone, I'll be glad to.
I know you will. I will. I know you will, and I'd be glad to
Right.
take you up on that offer.
Right.
But I really, that's a travesty in and of itself. Even the whole scenario, and I don't want to relitigate it, how this was all announced. No warning. There was a lot of mistakes made by Insight in that part of the process as well. I'm not trying to absolve them. But I do know the money is critical. Releasing of those funds is critical for us getting back to where we need to be. And that's why I'm calling on the federal delegation to be a part of the criminal investigation. Anyone else?
Yes, sir. I want to thank our mayor and Mr. Connolly and those who are working alongside our director to address this emergency. It's a crisis for the workers of the hospital and to the residents of our city, members of our churches, those who we work and live beside. You're talking about mortgages that need to be paid. You're talking about tuition for school. You're talking about groceries in an already inflationary time. And we cannot overstate the impact this is having on the Warren community, the strain it's putting on other health systems. I was just with representatives, management, and donors of the Mercy Health System last night talking about the strain that they're under trying to fill the gaps and the voids of care. And so, echoing the mayor, we're calling on Insight to communicate transparently with their partners, both in the government and in the employee sector, and Stewart to do what they need to do, but we don't have much faith in them. And so we echo that call for our state and federal representatives to come boots on the ground and have a presence. As Mr. Connolly said, there is nothing more important, no issue, no cultural issue, no political battle, more important in the Mahoning Valley than this right now. And so whether it's our state representatives or senators, our congressional representatives and our state senators and federal senators, we need them here. We need them fully putting all pressure and all screws that they can and turning and unturning every rock that they can from the state and federal level to make sure that our patients and our employees and our residents are made whole in this situation. And council is going to work alongside our mayor. I know I speak for our council when we say we're going to work alongside our mayor in advocating and making noise and continuing to reach out to those parties that are causing this situation and those parties that could help support the situation. Thank you very much.
Thank you, Pastor. So any other questions?
So, in no way to discourage Mercy, because I know that they're
Yeah.
working hard, but are you hearing that they're having a hard time keeping up with
I-
the emergencies in the community and the amount of care that is needed here?
I was there actually 3 weeks ago, and I could already see that their system was being taxed just visibly by the eyeball test. So I do have contacts constantly with their director. So their emergency rooms are crowded, their beds are filled up, so they're really busting at the seams and need some relief. I've always said we're a two-hospital community. They offer different brands of services as well, which is more important. It's a shame, as was stated earlier, if you're having a heart attack and you have to ride right by Trimble to go to St. Eve's, it's very likely it's a good possibility you might not make it. It's too far a ride. So that's what we're talking about on the ground. It's that critical.
And the mental health patients that
Oh,
are
good
handled there, what has become of them? What has happened?
You want to talk about that?
That's an excellent point. I mean, we, until now, I'm told that we're the only mental health place that's open. See, that when all this started, it originally started that they were going to maintain outpatient services, they were going to maintain the mental health floor, and we were going to have a layoff. Didn't like it, but that's what was going to happen. So, and then all of a sudden they came down there and they closed everything. And please don't forget Hillside Hospital. There's
Right.
450 employees over there
Yeah.
that are in the same boat as we are. Plus, I was having my neck worked on when they gave us the news that it was closing. So, needless to say, I didn't get my follow-up. My neck still hurts. But anyways, though, the mental health patients, we don't have a place for them. We don't even have our emergency room where we put a psychiatric mini unit in there to try to take care of people there. So I don't know what the mental health board has to say about it. And the other thing is, I'm all for forgive, but let's not forget.
Right.
Though, let's, you know what I mean? I mean, okay, if you didn't do it right, we can get over it, but let's do it right from now on, though, you know? So tell us what we need to do with these folks here, because they're going to end up in jail. There's a guy that, well, he's not right here, but in Boardman that was jumping on cars the other day because they don't have a place for him. He's in jail right now. So, at any rate, everything is closed down there, and we look forward. They told me that within a couple of weeks, pending funding, that they might be able to get outpatient services going. I'm assuming that might include the mental health, but once again, I'm assuming. And anytime you would say, give us a timeline, they won't. Tell us for sure, they won't. And and we can't operate like that. I mean, I can't anyways. My members are gonna go get another job.
Thank you.
Yeah.
Check with St. Joe's, please. When we had the first scare round of this, we did reach out to April Caraway of the Trumbull County Board of Mental Health and Recovery, and they were already through Coleman, I believe. They were sending over, they were sending workers to St. Joe's to be able to at least be able to take some of those people that were coming in. So before we believe we don't have a service, let's make sure that St. Joe's, because I do believe Coleman was sending people over to train as of when this all first started, to be able to absorb some of those, not to the extent in which Trumbull was able to do, but obviously filling some of that void for us.
Thank you. I'm going to have, you got another question?
One more question, yes.
Okay.
So I wanted to know, those federal lawmakers that you guys are calling on, have they answered any of those calls as of now?
I do know, and let me be clear, I do know the Ohio Department of Health has already been engaged in discussions. That's the state level. I believe that there's been some conversation with Senator Marino's office and Trimble County Commissioners to ask for help. I don't know if it goes to the extent of a criminal investigation, but I think that that's necessary, and from my standpoint and what I know about this case.
Congress
So
subpoenaed them.
those have been apprised of the situation.
Congress subpoenaed the owner of Stewart 7, 8 months ago, and he just snubbed his nose at the subpoena. So they're obviously aware that this isn't something that is just germane to Trumbull County and the city of Warren. There are questionable things that have happened throughout the country that Congress was interested in. Unfortunately, their subpoena was snubbed by the owner.
Cedric, would you like to talk about the services that TCAP offers? I didn't want to leave that out because this is important.
Sure. TCAP, we are looking to support our community on April 16th at 10 a.m. and once again at 2 p.m. We're going to see 50 people at 10 and we're going to see 50 people at 2. Our goal is to be able to assist those that were affected by helping them with their rent. Definitely March and April, and we're looking to give them a food voucher, and we're going to help some with their utilities as well. So right now, that is what we do have in place. There may be future dates that we will assist, but as of now, on the 16th, we will be serving 100 people.
Thank you. Thank you.
Okay, I just want to mention Jobs and Family Services is also having a rapid response meeting at the Kent Trumbull branch where our members can go out there and get answers to their questions. I thought they were going to be able to help them with their unemployment insurance, but I don't know that for sure. But at any rate, though, believe me, this community is great. We're so proud to be from here, you know, and that's what I say. For these folks that are just out of town, they don't know how we roll here, you know. So I'm sorry that they have to learn it this way, that us getting all mad and everything, but I don't know what else to do about it. We can't go on taking care of our people. Our citizens come first in our mind, right after our families and our loved ones. So they got to get on page with us. They've got to talk to us. They may own the hospital, but they don't own us and they don't own the community.
Man, we're about to find out.
Yes,
I
sir.
do have some flyers to those events if you need them for screenshots. And thank you for coming out. I really appreciate it.
Thank you.
Thank you.